I am Dr. JVV Raju, alumni of KV CRPF Durgapur. First of all, I apologize from being so late. Actually, Lalit is operating me from remote control. Actually, I am not very gadget friendly. I just use Facebook for wishing happy birthday and happy anniversary. Fine. I did my veterinary science, bachelor in veterinary science in from Durg, Chhattisgarh. I have 16 years of canine practice experience. That too, I used to give consultation for free and treatment for free. Now I am posted in those since last 1 year. My wife is also a veterinarian. First of all, hi Manpreet, and I got some questions. You can go ahead with your questions. I'll answer them one by one. Recently, I saw Lalit send me some queries. There were queries in the book in the group. I'll answer. I'll start off with that. First question was: is corona transferable from pets to humans? Actually, the name of the coronavirus is COVID-19. That is novel coronavirus. There have been reports that it has been transmitted from bats to humans. As of now, there is no substantial evidence to prove that pets can transmit coronavirus to humans. Yes, coronavirus infection is present, is found and common in dogs and cats, but those coronavirus is a different kind of coronavirus. In cats, it happens that there is a gastric disturbance, and in pets, in especially in dogs, there is some diarrhea and all that. That is not at all transmitted to humans. It is localized. It's species specific. That is, it is specific for dogs and it's specific for cats. The second query was, can we can pets wear a mask? As of now, there's no need for pets to wear a mask as far as the reports are coming. I have been in regular touch again with the latest information. No. And there have been reports that the tiger in Bronx, New York has been infected with COVID-19. But it is said, let me tell you, it has not been substantiated till now. It is said that the infection spread transmitted from human to the tiger in Bronx in New York. There was another report from Malaysia that 2 tigers have been infected, but that is said to be transmitted from humans, not the vice versa. Secondly, what food should we give to our pets? That's a very big issue, because when we were studying our veterinary graduation, very little information was there regarding the feeding of pets. Actually, we used to concentrate on feeding of cattle, buffalo, wild animals, sheep, goat, camel, and elephant. Very little information was there about pets. Now the emerging pet nutrition has been an emerging science. Let me tell you, let us start off with felines especially. Let us start off with feline cat nutrition. I'll be very, very specific. Feline need an entirely different kind of nutrition. You cannot keep a cat on vegetarian diet. You have to give it non-vegetarian diet. You have to give it non-vegetarian diet. Especially the felines have an inability to synthesize taurine, which is an essential amino acid. If you don't, if it without taurine, the cat, actually the feline will die. So you have to give it non-vegetarian food. I have cases. The cat, it cannot see properly. They won't even report. The animal owner doesn't, the client doesn't report that the cat is blind. He doesn't know the cat is blind. That he says that it walks along the strange behavior. I went and saw, I wanted to see it in the house, actually, how it behaves in the house. I went and saw the cat was walking along the walls. I immediately tested it and said it is blind. It cannot see. It's become temporarily blind. It cannot see. It was a real tomcat. I just immediately asked him, what do you feed? We feed him liver and chicken legs. I said, that's not enough. That's not enough. That's not enough. You have to give it whole, complete bones, liver, meat, and other offals. Offals meaning intestine, parts of the intestine. because they contain different constituents, protein constituents, and mineral and vitamin constituents. You have to do it whole. The best thing when you are living in a city is that go for complete packaged food, but you have to be very selective at which food you give it, because there have been reports some food, dry food especially, don't give it dry food, you wet it and give it. Some dry food contain high level of oxalates. Some brands, I won't be naming the brand, that's not what you call, how we call ethical to for me. You have to give it some brands, specific brands, and you have to give it, you have to soak it in water and give it. If you give it dry food, there are chances of urinary calculi developing. That is urinary stone in normal language, in common layman's language. That's urinary stones. You have to give it wet food. There are specific brands which offer feline food, reputed companies. You can go for them. Now, let's. You have any doubt regarding feline nutrition? I'll answer them. You can type it there, or you can. I'll proceed to canine nutrition. That is dog nutrition. Please, if you have any note. Okay, I'll come back to that. As regarding dog nutrition, there's a fallacy that you should not give sweets to dogs. And usually 98, I won't say 98, I will say 99.99% of the dog owners, they feed them roti and milk. That is roti and doodh. Let me tell you one very specifically you have to be, never feed a dog wheat or its products. When I say wheat, it means roti, biscuit, maida, or anything made of wheat, because the gluten allergy is there in canines, that is in dogs. And secondly, dogs are lactose intolerant. The as they proceed, as they age, they become more lactose intolerant. That is why please don't give it milk or its products. When I say milk, I mean dahi, I mean yogurt, I mean paneer, I mean chaach, I mean buttermilk, I mean whatever you say. You shouldn't give it sweets also, because there's a popular fallacy saying that if you give sweets to dog, they start shedding their hair. That's because you feed it rasgulla or gulab jamun, which is made from milk. You can give it besan besan ka laddu. It doesn't do any harm, but make sure there is no ghee in it. Make sure there is no ghee in it. Okay, that's a milk product. There's traces of lactose in it because it's not purified properly. Okay, fine. You can give it sweets. You can feed it sugar. It doesn't matter. It doesn't cause diabetes. Of course, there is diabetes in the mellitus in dogs. Once it's diabetic, you shouldn't give it high sugar, as you have to take precautions as you take in humans. Secondly, if you want, there was another query as how do we give it vegetarian food? Vegetarian food, you should give it rice. Rice is very good. That's a hypoallergic diet. Go for a hypoallergic diet. You can cook it along with vegetables. Make sure you don't give it potatoes. If you have to do potatoes, make sure you mash them, because dogs don't have chewing teeth. They swallow. If you give it if you give it potatoes, it might choke. That's why you make sure you mash it. You can give vegetables. You can give vegetables. You can give dal. You can give salt, and don't give it masala, garam masala. That causes anemia in that. And what not to give? You can give soya bean, nuggets of soya bean. That's a complete protein. That's very good vegetarian diet. You can add different kinds of dal, because some have some essential, some essential acid, and they lack in some essential acid, and some dal they essential acid. Same case with humans. You have to give pachmel dal. That's very good, and you have to give it soya bean. That's very good. That's very good. Secondly, I'll tell you what not to feed dog. For example, the primos is never feed chocolate. That's poison. That's poison for dogs. Never feed it chocolate. It causes toxicity. Secondly, never give it apple or almonds. That's cyanide. They got cyanide poisoning in dogs. Don't give it onions and garlic. Don't give it. Please don't give it onions and garlic. And tomatoes, of course. Tomatoes. You can give it rest of the foods, especially cucumber. You give it okra. You can go for other fibrous foods that help in the digestion. Okay. As far as I just someone say since 10 days onwards you give milk only, Mr. Ajit Kaur Dhillon. You can give it milk, but there's the special Cerelac formulations for pets. There are special formulas they have come. You can give, you can feed it. And when taking care of a newborn puppy, make sure you bring it when it's at least 4 weeks old. Then you have to give it the capacity of a 15-day or a 1 month old puppy is around 5 ml. The capacity of it 4 ml to 5 ml. So make sure you don't give it, feed it more than it will cause diarrhea. And you increase, you have to feed it at least 8 to 10 times. Because every day the exponential increase in their live weight, this birth weight, body weight. You have to give it increase the number of times, reduce the amount of the food, and increase the number of the frequency of the feeding. Okay. As far as dogs, Manpreet, yeah, I'll take up the question. There's no special diets there's no specific diets for dogs in summer. You can give it. People prefer you don't give eggs in summer. You don't give it non-veg and non-vegetarian food in summer. But let me tell you one thing: it's a carnivore. It means the scientific name itself suggests that it's Canis familiaris. Canis meaning the canine teeth. Canine teeth is a sign of carnivore. We don't have prominent carnivore. We are omnivores. We have carnivore. It's a carnivore. You don't see lions eating grass or vegetables in summer. You can feed it non-vegetarian summers. Make sure you give him a lot of water because they need water. Okay. Ajit code. Okay, fine. Secondly, when you there are some dogs called, especially breeds like pug and boxer. They have short nose. The head is compressed. They are called brachiocephalic dogs. As far as I don't recommend. I can't say because I'm professional. You can keep them as pets, but you have to take special care because what happens is you can see you panting like there's a expression called panting like a dog. Panting like a dog means actually you see dogs don't sweat. They don't have sweat glands. So they do the thermoregulation. That is they regulate the body temperature to panting. So there's a special organ in the nasal cavity that's thermoregulation. The air passes through and cools down the body. But especially in breeds like pug, boxer, and bulldogs, nasal space is very reduced because the head is compressed. It's almost a human-like face. It's compressed. So the thermoregulatory space, that's the space with the temperature control, it's reduced. That's why they keep on panting and they get hot, very early, very fast. So whenever you take it out for a walk, wet it a bit, wet it a bit. Don't soak it. Wet it a bit before you taking out for a walk. That will take care of the temperature. Thirdly, any more questions? You have to feed dogs vitamin D and calcium supplements throughout their life, and only during pregnancy should you stop it. Or you can't say you can't express. Pregnancy is very difficult to diagnose from outside without ultrasonography or X-ray. So when you're taking your breast for your breeding, stop giving it calcium supplements because that will turn unnatural puppies or deformed puppies. As far as the reason for giving calcium supplement, and make sure there is vitamin D in it. There's a the supplement with the calcium supplement which you are giving contains vitamin D, because what happens is very logical. Our skin is exposed to sunlight, so the vitamin D is synthesized in your body in the skin with the help of sunlight. Whereas in dogs, the skin is not exposed to the sunlight, so they are unable to synthesize vitamin D and regulate their calcium metabolism. That's why they need extra calcium supplements for their regulation along with vitamin D supplements. Okay. Thirdly, you should give a whole complete food. That actually the range of food that depend. Go for a hypoallergic food that will cause less hair fall. Of course, when I say less hair fall, there are shedding seasons. Like we see we too shed our hair regularly. They too shed their hair. But if you give them allergic diet, that increase the rate of the shedding. Give it a hypoallergic food. There are hypoallergic different reputed brands. You can go for them. They are formulated according to their stage of growth, that is the puppies and the growing growers and the adult. And there are different foods for miniature, for small breed, medium breed, large breed. Their needs are accordingly formulated. So you can go for that. It won't be ethical for professional for me to recommend any specific bird, specific brand, but you can go for the lot of breeds available. You can take the advice of a local veterinarian and then go there. Okay. Thirdly, vaccination, and of course grooming. Grooming is very important. What 90% of dog owners do, they use Dove shampoo or Head and Shoulders. I'm specifically naming because they are very good brands. Dove is a very good brand, but it is very harmful for dogs because our skin pH is acidic, that is slightly acidic, whereas their skin is slightly alkaline. When I say alkaline, it doesn't mean alkali, or our skin means hydrochloric acid or hydrosulfuric acid. It means slightly acidic, and this is slightly alkaline. And secondly, when you use a soap that causes rashes and skin fall, so go for a specific dog shampoo formulated neutral dog shampoo and dog soaps, and usually try to see how often do I gum. That's good. That depends on how often you can give it, because too many bars and things. Make sure you dry it properly. It gets dry properly, and you pat it dry properly. You can go for every 4 days or a 1 week or like that. If you have a problem with their smell, you can't help it because it too can't stand your smell. It too can't your odor. You get a dog odor, but it's very sensitive to your odor. So you mask it by using deos, and they too there are deos available for masking the dog odor. Of course, it creates a confusion for the dogs because it can't smell itself, and it confusion for other dogs because they confuse it with some deo brand because they can't smell properly the proper dog odor. They don't get a dog odor. There are, of course, they are cosmetic. You can use them. Of course, you can bath it every twice a week and all that. You can go for grooming because nice breeds like Shih Tzu, Cocker Spaniel, and Poodles, they go for grooming and they go for hair trimming. Make sure you trim the nails properly. And supposing the hairs overgrow, you take it to a veterinarian or a grooming parlor. They cut the nails, a little blood comes out, or a few more drops come out. Don't be alarmed. That's okay. That's okay, because they got a high blood supply. That's okay. They'll apply permanganate or apply cotton dog for it. They'll cauterize it. No issue. That's very common because it's very difficult to for dog cutting because the dog can be satisfied. You can satisfy the dog, but it's very difficult to satisfy the owner. You can satisfy the patient. It's very difficult to satisfy the owner. They get alarmed when they see even a bit of drop of blood. That's okay. You can take it coolly. It doesn't matter. Thirdly, thirdly, vaccination. Vaccination is very important because when you're keeping a pet, it's not the financial value which matters. It's the emotional value which matters. Vaccination is of two types: core and non-core. I'll repeat I'll repeat it. There are two types of vaccinations. One is core vaccine and second is non-core vaccine. I'm sorry. When you say core vaccine, it includes rabies. I'll stress the word rabies once again because it's highly infectious. I can't stress because there are many anecdotes about rabies. Even if they say that even it happens only when a dog bites you, it doesn't matter. Even if it licks you, that's more than enough to cause rabies. Even if a mad dog, rabid dog licks you, you can get rabies after 10 years because of that lick. So be very careful when you handle dogs. Make sure you vaccinate the dog. The first vaccine of rabies is done at 3 months of age. There's a booster after 1 month. 1 month. Actually, any vaccine, there should be a gap of 21 days between two vaccinations. That's very difficult to remember. That's why we say 1 month. And after that, annual booster. Make sure you keep the card. You keep the card in a safe place. Make sure you take it to the veterinarian whenever you visit the vet along with your pet. Second type of core vaccines is parvovirus, canine distemper, infectious canine hepatitis, leptospirosis. These are core vaccines that because they threaten the life of the pet. And third, non-core vaccines are corona vaccination. Some people opt for it, some don't. It doesn't matter. There are many vaccines which contain all these. But I'll stress, apart from rabies, this leptospira is very important because that's zoonotic. Zoonotic meaning that transmits from animals to humans, and that causes nephritis. That they causes diseases of that causes diseases of the pet, your dog, and also diseases of human kidney diseases. So make sure you go for that. Yeah, that's too Pradipti. You give your food like dog food for dog food, and cat food. You can't mix it. You can't mix it. Any more questions, please? I just covered the overall view. Of course, training. That's you have to be very patient with training. Let's not leave out the training part of it, because that's you get a very well-behaved dog or a ill-behaved, ill-tempered dog at this thing. Whenever you see a dog, never hit your pet because it doesn't understand. It's a you can say it's a 2-year-old or a 1-year-old child. That's the brain of it's got a intellect of a 1-year-old or 2-year-old child. It just responds to a tone. You can call your you can call you out to your pet name in anger, it will respond likewise. You can call out in with love and affection, it will respond in kind. And dogs are just devoted to their owners. Okay, they have hierarchy. The owner of the house, I don't know whether it's you or your spouse, I don't know who, but it recognizes one of you as owners, and it treats your kids as their you can say a playmate or a sibling. So it has some dogs are very friendly, some breeds of dogs are banned in some countries because they are violent on kids and children. Some are very friendly, and they are you can start training your dog at 3 months of age. There's the ideal time, and you have to be very patient. You have to be very patient to give instructions to your pet. You need a treat, and you have to give it at every time. It makes it right, and they respond. That's like Pavlov's response we studied in our school. That's the first thing we studied in our science. Pavlov's response. That's in the digestive system we studied. Everyone studied in KVs. So you have to be train it, and never hit your dog, and never scold it after it has done something. You have to scold it immediately. Suppose it take out a slipper or a boot and chews it to bits and bits. You can't hit it after 1 hour because it doesn't understand. You have to do it immediately. You have to do it immediately. Like suppose you go out for a job, you go to the market, come back and found your dog. It greets you, and you see that it has chewed your slipper, and you scold it or you hit it. It thinks that maybe just because I wish my owner as soon as he came, him or her came from market or from outside. That's why I got scolded, because it doesn't understand. It forgot that it chewed your slipper. It doesn't matter. That's done. That's done. Yeah, training at the age of 3 months of old. That's the ideal age. That's the ideal age. Time is whenever you feel fine and whenever it's not sleepy. Okay, so you have to be very patient. You have to look it light into the eyes and scold it loudly in a firm voice, and you have to make sure look it into the eyes, because animals, they depend on eye contact. Even when you are scared of your father, when you are a child, you wouldn't look. When your father was scolding, we didn't used to look him in the eye, because that's a challenge actually. That's animal instinct. So make sure you look into the eyes, grab, hold its muzzle firmly, and look into the eyes and scold it loudly. That makes him feel silly. You won't do it. You won't repeat it. You won't repeat it. Never hit it. He won't understand. He doesn't understand violence. That will make him ill-tempered and a bad dog. And you have to give it away. That's a very wastage of a dog. Okay. Training, I said any more this thing, I suppose I call the basic aspects. Okay, let me tell you one thing I want to do, because I'm very particular about this. I'm very particular about this. I get angry whenever I hear such things. Never allow your vet to give 2 vaccines at a time. Please. That's again my ethical, that's against my professional conduct. But I tell you, never let them vaccinate your dog 2 vaccine shots at a time because they'll interfere with the immune response. Make sure between vaccinations, make it for 7 in 1 or a 9 in 1 or 11 in 1, whatever they do. There are two kinds of vaccines available. One is anti-rabies and other is multiple disease rabies. Sometimes even rabies is included in those. Make sure between two vaccinations, two vaccine shots, there's a gap of at least 21 days. So thumb rule is make sure there's a gap of at least 1 month between those. As far as the multiple disease, several diseases, they call it 9 in 1, we call them 9 in 1 or 8 in 1 or 7 in 1, whatever 30. There are also 11 in 1. You give it at the age of 8 weeks. I repeat, 2 months or 8 weeks. Some quacks or some unethical practices are some even the companies just to push forward the vaccine sales, they do it at 6 weeks. I'm sorry, I beg to differ. The vaccine maternal antibodies, they are active till 8 weeks of age or 7 weeks of age. If you give it at them, that will interfere with the vaccine response, immune response. Make sure the first vaccine is done at 8 weeks of age. Okay. After that, after 1 month, there should be a booster for them. After 1 month, that is at the age of 4 months, of course, they should be done at 3 months, but because of the booster, it's at 4 months. Make sure you give it anti-rabies vaccination. After a month of that, booster of anti-rabies. After that, every year within a gap of space of 1 month, booster for both the vaccines. Okay. Anything else? Any more queries? I do. Okay. When you bring it from a litter, don't be over anxious and bring it from the mother very early. At least make sure it's 6 weeks of age before it comes to your home, because it's too early to bring it. But it needs its mother for proper cognitive growth and mental growth and physiological growth and of course good health. Make sure you bring your pup at 6 months, 6 weeks of age, not before that. And of course, don't overfeed it in your love and affection. Sometimes I've seen many pups die because not of disease but of love and affection. Because the owner feed it, the kid feeds it, the spouse feeds it, the friends come and they feed it. Finally, it ends up with diarrhea and it dies because of dehydration. That's a very sad part I've seen. Many a dog pup have beautiful pups there with lots of affection and lots of money. And let's not speak of money because you're bringing it's like a family member. Bring a house or a feline, not much with feline because they're very independent, especially with pups. They do a lot. They do the early pups. They die of love and affection and because of overfeeding rather than an infection. Yeah, that's true, Shekhar. That's true. I don't know where you got a woodpecker from. That's okay. And owl, that's fine. We say the dogs become like their owners. That's true. They act like their owners. Because we had a dog. Of course, you have seen it. Some of my friends have seen my dog. And fortunately, I saw by coincidence, my dog's name was Shweta. It was a male albino German Shepherd. And my wife's name is also Shweta. I can't help it. I had a dog. I raised it by my own. I had a German Shepherd, and it was very naughty, just like me. So of course, they share the mood and the personality of their owners. That's true. As far as the nail trimming is concerned, just make sure that they don't overgrow. And there's something called Dewclaw, especially that's common in German Shepherds and some pets. They ingrow and they cause abscess. That is what we call in Hindi foda, or what you call an abscess of a cyst. So make sure you cut it, you get it excised. Sometimes they do it, some vets do it surgically, or sometimes they just trim it. Make sure you do that. That depends on Manmeet. I'll take up your question. It's a German Shepherd female. How it's going to take up your puppy? Usually, German Shepherds are very, very protective and very, very, what do you call, friendly. They'll make sure they keep a You give it time and space before it gets starts playing with your pug puppy. Because German Shepherd female, you 1.5 years is almost a very young dog and a full-grown dog. All it needs is just needs to grab it with your mouth, and the pug puppy will die, or at least it will suffocate. Make sure you introduce it slowly and slowly, get it accustomed, because this sort of jealousy also, the very human in nature, like human like nature, they got very emotional. Dogs are very emotional, and the puppy can be very naughty. It will start troubling your German Shepherd. So make sure you give them space and you give them time before they get. After that, even if you scold your puppy, the German Shepherd is going to bark at you. It's because they are very protective. They are very protective. That's true. They are very protective. They become very protective and very obsessive with their friends, and they really become emotionally attached to them. Anything else? I don't think I left anything else, anything out. General idea is okay, and your neighborhood vet will always be very. He'll be enthusiastic. After that, I suppose after all this session, you have some. I suppose even if you got hold of 10% of it, that he'll be very enthusiastic, because we find it a lot of problem with the clients that they do as they like. They don't have an idea. You need to educate them first. You need to educate. We have to educate. Whenever they being a puppy, I give at least half an hour with them. I spend half an hour with my pet parents, so that they don't have any trouble with their pups. Anything else? I suppose that's all. You can I'm your face. You can always post your queries on the group. I'm always ready to answer them. Anything else? Okay, thanks Lalit once more. It took a lot of pains and lot of patience with my what you call my very unknowledgeable, what you can say, unknowledgeable. Tears are normal. Tears are normal. It doesn't matter. Tears are normal. Make sure it's not bilateral. That is, the tears don't come from both the eyes. If it's both the eyes, something is wrong with your eyes. Just have been checked in with the vet. Get it checked with the vet. Sometimes they don't actually cry. They get moist. Actually, they don't cry. They're moist, because crying is not an essential emotion of a dog. If they get emotional, they get moist. And sometimes if it's both the eyelids, sorry, you can see if it's one eye or both eyes, it may be some systemic infection or a trauma to the single eye. Just get it checked, but don't over medicate it. That's what I say. I don't believe in medication. I don't believe in treatment, because I don't get ill, because I eat well, I sleep well, I live well. So I don't go to the doctor once every 1 month or so. Please don't take it to the vet for no rhyme or reason, because it might get infected out there. You keep it well, you keep it clean, you keep it well. Usually, I just want my pet parents to visit me with their pets only once in 6 months or 1 year. Of course, that's bad for my practice, because I don't practice, I don't charge, doesn't matter for me. I believe in seeing a vet once in 6 months or a 4 months or a blue moon, because they don't fall often if you take care of it well. They don't fall in if you take care of it well. Okay, fine, guys. Thank you for giving me platform for this thing. Thank you, and bye.